Pamela de la Cruz, and I would be doing a video demonstration of how to reconstitute, dilute, and administer an IV medication through a mini bag. First, I would do hand hygiene. And next, I will check my doctor's order and compare it to my MAR. So for Mr. Anthony Medina, who was admitted for peritonitis, dehydration, and nausea and vomiting, doctor's order is cefoxitin 750 mg IV every 6 hours, which is now at 1400. All right. And now I would be getting my medication in the Pixie's room. Now that I have the cefoxitin 1 gram vial, I have to do my first check right away. For Mr. Anthony Medina, a medication cefoxitin 750 mg, and I have the 1 gram vial, which is enough for my doctor's order. 1400 now through an IV. All right. And to know how to reconstitute and dilute this medication, I have to check my monograph for that. For cefoxitin, 1 gram vial, add 10 ml sterile water for injection, and I would be getting a final volume of 10.5 ml and a final concentration of 95 mg per ml. For IV intermittent, I would dilute in 10 to 100 ml D5W, normal saline, lactated ringers, or dextrose saline combination, and administer over 20 to 60 minutes. The maximum single dose is 3 grams, and my dose is 750 mg, which is appropriate. And I would just have to check the compatibility very quickly and the potential hazards of this medication, contraindications, and if there's any additional notes. All right, now I would have to get my other stuffs ready. Now, before dilution, I would also do my second check at this time. Hand hygiene, give aseptic technique. So cefoxitin 750 mg IV at 1400 now for Mr. Anthony Medina. That's right. I would clean my vial of sterile water for about 30 seconds and leave it to dry for about 15. Same as my cefoxitin vial, clean for about 30 seconds with alcohol swab and leave or let it dry for about 15. Now we're gonna use our syringe and blunt needle. Now, because we're needing 10 ml of sterile water, we have to draw up about 10 ml of air to give a little bit of pressure. Are you done? And let the plunger go up on its own so it won't be that hard to get our sterile water. And make sure there is no air or bubbles. And now that we have our 10 ml, we can put that in our cefoxitin vial. And rub it through our hands to further dilute the medication so it is well mixed. Now, to know how much we have to draw up to get the 750 mg doctor's order, I calculated 750 mg of the doctor's order divided by the 1000 mg, which is the 1 gram vial, which is the stock dose, multiplied to 10.5 ml, which is the final volume in this vial. I got 7.895 ml, and that's how much I need to draw up. Now let's clean our vial one more time. to clean and remove any bacteria for about 30 seconds and leave it to dry for about 15. And let's draw up our 7.89 ml of air, which I would leave the plunger to the middle of 8th and 10th line of the syringe. And put the air in the vial and get our desired dose, which is the 7.89 ml.
Okay, so I'm washing my hands. Hello, Mr. Friesen. My name is Jillian Stewart. I'm your nurse today. I'm a student nurse, and I'm going to be
And make sure there's no bubbles.
for your pneumonia that you have. And so hopefully it will help
When we got
your fever.
the right dose,
Do you have
it is almost ready for
And can you state your name and date of birth?
dilution.
You don't have any allergies?
What I chose here is a normal saline 100 ml. I chose normal saline because first, the primary that is running is already normal saline, so normal saline is compatible. And also it gives extra, or it will replace the losses that the patient had because the patient has nausea and vomiting. I also chose 100 ml to give extra volume for dehydration because the patient also has dehydration. And I would run this for the whole hour or 60 minutes, so I have enough time or extra time to catch any adverse effects because this is the patient's first time to get the cefoxitin medication, and so I have enough time to shut or to close the infusion right away before it gets any worse. All right,
And now I'm going to
and now I can also do my label. Also, before using this bag, we want to make sure that we check the expiration date, that it is not expired. We look at the consistency of the solution, if it's clear and there's no crystallizations, to avoid any issues. Alright, and this is clear. Now we're ready to put our medication.
Then I'm verifying as
I'm
well.
going to clean the port.
I'm going to verify that everything
About 30 seconds.
This medication, I just have to include my about
Make sure both ends are clean.
watch out for different evaluations as well, and also make sure that it does not have any allergies. And so I'm going to clean it for normal saline. So I'm going to go to the part and get my medication.
And I would get my label ready for my patient Ansley Medina, cefoxitin dose 750 milligram, date and signature. And at this time I would also do my 2.5 check to make sure everything is right. I would put my label on the side as well so the other healthcare providers would see what's in the solution and what kind of medication is inside the solution. Sir Ansley Medina, cefoxitin 750 milligram, today at 1400 through an IV.
I'm going to come back.
And I have to get the other stuff ready, alcohol swabs,
Symptoms are better, and I'm also going to
and my label. And we're ready to go to our bedside or to our patient. And before that, we have to do our hand hygiene again to keep sterile technique. Let's bring our Mar with us. At this time, I would do a very quick safety checks. Call bell is in within reach and railing is up. And I would introduce myself to my patient. Okay. Hi, Mr. Medina. My name is Pamela Dela Cruz, and I would be your student nurse for today. I will just check your armband. Can you tell me your first and last name? And your date of birth? Oh, we have the same birthday, Mr. Medina, in a few weeks. Good, thank you. Alright. What I have here is your antibiotic, which is the cefoxitin, which is a treatment to your peritonitis. So just to let you know, Mr. Medina, there's some common side effects of this medication, which is like rash and nausea and vomiting, abdominal pain. For some reason you experience that, you can call us right away. But first of all, for some other reason that you don't want this medication, you also have the right to refuse. So can I ask if it's okay to give this medication to you? All right, thank you. Can I also ask if you have any allergies, Mr. Medina? All right, good. Just to make sure, because this medication is contraindicated to penicillin as well. All right. Thank you. Can I also just check your IV site? No tenderness, no inflammation, it's not warm, and IV is running good. Just gonna fix this a little bit. Alright, and I'm just gonna hang this medication. At this time, I would do my third and last check just to make sure everything is right, and I check my patient at the same time as well. Cycloxetine 750 milligrams. Today at 1400 through the night. Now we have to get our secondary medication set, and when we take this out, make sure that everything's intact and both ends are clean and closed. We're gonna hang our primary lower so that when our secondary medication is done, it would run on its own through gravity. First, now we're gonna clean our port for about 30 seconds. And make sure both ends are clean and sterile. And we can do back priming. And we have to make sure that there's no air or bubbles so we can avoid any complications. And if the chamber is about half or 3/4 full, that is okay, and we close the clamp. And now we are ready to spike this secondary medication. And it is ready to hang. Because I have 107.89 here, and I would run it for an hour, I would put 108 ml per hour. The volume is 108 ml. Confirm secondary and start. Make sure all clamps are open. And I would wait for the first 1 to 3 drops of it, and I saw the first drop. I would also put a label to my secondary tubing to make sure what time we put the tubing, and for the next healthcare provider to know when to change this tubing as well. Okay, Mr. Medina, I'm just gonna stay here for a few minutes to monitor if there's any abrupt or any adverse effects. After that, I would document and sign my mark that I gave the medication, and would also write that in my fluid balance sheet. And Mr. Medina, after this is done, after an hour, I would come back and evaluate the effectiveness of this medication and also evaluate how you're doing. All right? If there's anything that you need, or if there's any side effects that you feel, please feel free to ring the bell and I will be right back. All right? Thank you very much. Thank you.